it's you, that is false, and it's true. I know
Morning Springfield. It's so good to be with you today. And as you know, if you're a regular Good Morning Springfield attendee, this is our first ever virtual Good Morning Springfield hosted by the Springfield Area Chamber of Commerce. I'm so glad that you can be with us today. As you know, also, if you're a regular attendee, we try to get a little interaction going with our audience. So I'll say, when I say Good Morning Springfield, you say, and that's where it feels a little lonely for me right now because we're in studio, but I hope that you at home jumped right in. Instinctively, your family might be looking at you a little bit funny right now, but really, really glad you can be with us. Hundreds of people already joining us for the Zoom broadcast. That's the link that we sent out. I want to let you know, though, that there is a capacity on the Zoom network. So we're also simulcasting this on our Facebook page as a Facebook Live event. So if it's equally valuable to you to be on Zoom or on Facebook, I would encourage you to maybe check out the Facebook Live to create the little bit of room on that bandwidth for the Zoom page. Again, it's Springfield Chamber page on Facebook Live, the Springfield Area Chamber of Commerce. We'd love to have you with us for that as well. And as you are sharing what's going on today, we normally invite people to share on their social networks what they're learning as a part of Good Morning Springfield. And to do that, we ask that you also use our hashtag. That's hashtag GoodMorningSGF. As you do that today, you can not only share what you're learning, you can actually share Good Morning Springfield. You can share the live event from Facebook or on your other social networks. Encourage you to do that today. We have a great program set up for you today. A lot going on that we want to cover, highly relevant content. Conditions in our world, in our nation, and certainly in our community have changed significantly since our last meeting. Only 1 month ago, we were cautioning each other to maybe consider not shaking hands on a regular basis. And we had some hand sanitizer out next to the breakfast lines, but so much has changed in just a month. And while our chamber team and volunteer leaders really wish that we could be with you in person, we can't do that today, but we're so grateful for the opportunity to be here in this virtual way as well, and that the technology allows us to meet together. Before we get to timely updates from a number of leaders in our community on the front lines of the coronavirus fight right now, I do want to take just a moment to thank our sponsors for today. First, I want to have a big, big thank you to our series presenting sponsor for Good Morning Springfield and one of the most generous community partners that you'll ever find, BKD Wealth Advisors. We're so grateful for your support of this program and especially thankful today as BKD Wealth Advisors has offered their time as a sponsor to our host, DMP Digital Monitoring Products. DMP is providing us with this studio and with their team to help make this production happen and the live stream take place as well. And so we're so thankful for that. We'll actually hear from DMP in just a little while, a little later in the program. And our monthly sponsor for Good Morning Springfield is Cox Health. And our thanks right now go far beyond just the regular support of the Chamber of Commerce and certainly their support as our April sponsor for the Good Morning Springfield program, as they had already been lined up to do that. But we are so, so grateful for the leadership of Cox Health in our community and dedicated service to protect our community at this critical time. So we're going to hear a little bit later an update from Cox Health CEO and President Steve Edwards as our April sponsor, and he'll be joining us by video a little bit later today as well. So joining me now as we kind of move to this first part of the program, I think it's really important to have an update from the person who is absolutely on the front lines of this fight in our community, and that's Clay Goddard. Clay is the director of the Springfield Greene County Health Department. Really, really glad that Clay is joining us today. Clay, thanks for being with us.
Good morning, Matt. It's hard to believe that was just a month ago that we talked about handshakes.
I know, it seems like, and that's, I guess you mentioned earlier, this whole situation is like counting in dog years.
Right.
It moves so rapidly.
Yeah, we've got to quit meeting like this. When the health director leads off Good Morning Springfield, that's usually a bad thing.
I think I'm going to miss you if that happens, but we'll be ready. Clay, if you would, I know that our viewers, our members, and others in the community are very interested in just kind of this up to the minute. Where are we in the state of the battle against coronavirus? Big steps taken in our community. I think largely thanks to your leadership, those steps were taken in a timely manner. But that doesn't mean that there aren't still daily updates on the metrics that we're keeping an eye on. Would you please share that with us?
Sure. Your public health system is working very hard. And when I say public health system, I'm not just talking about my health department. I'm really referencing all of our healthcare community, all of our leadership. They're really in a pitched battle against this. We currently have 55 cases. Unfortunately, we've lost 6 to this illness. We've had another 10 recover. And if you look at really across the the state, I think that we're performing fairly well. And we've really crafted our strategies around three really basic approaches. I find that humans can be fairly arrogant, quite frankly. We think that we can use technology to get out of everything, but really the approaches that we're using right now, two of them probably date back to the dawn of time. We realize that sick people shouldn't be around healthy people. So I want to start with containment, and that's a critical piece to this puzzle. We're working very, very hard regionally to make sure that we find people who are sick early, that we find people that were exposed to those people before those individuals get sick, and we do what's called quarantine. We ask them to stay home away from others for 14 days. The staff at the Springfield Greene County Health Department has been very creative. We currently have 305 people under quarantine orders. That's a massive lift. I would have never thought that that would be possible. And my team has actually developed capacity to manage 50 cases a day. I don't know that we ever get that to that level in Springfield, but we're offering to help our regional partners, and they're offering to help us. So we're working very well across county lines, because this virus does not recognize county lines. We also isolate people that have been tested positive, and really that takes me into what would be a second pillar. So you go from containment to testing. And we made an announcement that Dynamic DNA has developed that capacity to provide up to 500 tests a day. They can get that turned around in 24 hours, and sometimes maybe even the same day. That's really a game changer for us, because if we identify that infection early, we can get to that isolation more effectively. We're going to be able to move quicker on those quarantine orders and that contact tracing. So once again, that's a very critical piece to an overall puzzle. And then finally, what we call mitigation, and it's something that you're all familiar with, the shelter at home order. It's interesting to me that if you look back at history, they were using shelter at home or stay at home orders back in 1918 in Springfield. They did the same in St. Louis. These are really elegant, very simple tools. And stay at home literally means what it says. Unless you are in that essential business category, it's best for you to stay at home. A virus needs fuel, and the fuel for a virus is when healthy people interact with sick people. And we know now that this condition tends to present itself as asymptomatic. We worry about people that have very mild disease passing this on to other people, and that's why really you're called to duty. If you don't have to show up for an essential business, if you can work from home, stay on that couch. That's your sacrifice. And the hope is that if we can take this seriously, that we can get through this quicker as a community than the rest of the state.
Clay, thanks so much for that update, and really just thanks for your leadership. You and your team, you have just a tremendous team at the Greene County, Springfield Greene County Health Department that has been really working around the clock on this. I'm grateful for your leadership and for just helping us to understand what we're dealing with along the way. Let me ask you just a quick question kind of to that effect. As you look at where we are and where we've been and kind of the steps that we've taken to this point, how do you feel like we're doing? Are we taking the right steps at the right time? What's your assessment if you were to grade us?
I would give us an A. We got on this early. We had leadership comprehend the magnitude and the seriousness of this issue, and they took bold steps that, quite frankly, none of us thought we would have to take. Steps that were painful, steps that have impacts, but I think that we're ahead of the game, and we have incredible relationships and capacities in this community, and we've got grit, if you will, and we're going to get through this together. We've just got to steer the course, and that's really the hard part, is continuing to steer the course.
So we hear a lot. I think one of the things we hear a lot from people, there are phrases that we use today that we didn't know existed a month or two ago. And
Right.
one of them is flatten the curve, right?
Right.
As we talk about what it means to flatten that health curve, I think people are starting to understand that a little bit. We're trying not to overwhelm our health systems. We want to make sure that they're that they have the capacity to deal with these issues as they come in. And we don't really know what the reality is of the dynamics of this particular disease as we learn it along the way. So I think one of the things that people probably understand by now is that the efforts that we've taken to this point are intended to flatten the curve, but they're also intended to do something else. Taking the right action early, the bet is that we maybe give ourselves a chance to come out of it sooner.
And that's the hope. As Dr. Fauci is fond of saying, the virus determines the timeline, but we can influence the virus. He doesn't say that part. That's my addition to that. Yeah. And by doing the right things with quarantine, isolation, this rapid testing, and by stopping social interactions, even though we're tempted to find ways around that, you can really flatten that curve. It's going to help our health systems care for the most critically ill. And additionally, we may be able to keep a smaller percentage of our population from getting sick in this region.
Which, of course, ultimately is what we're going for.
Correct, yes.
So, Clay, a lot of our audience, a lot of our Good Morning Springfield crowd, even when we gather directly, it's a lot of people who are in business, a lot of people who care a lot about the success of business and the workforce, so that we can have good jobs for everybody. In the course of doing this, we had a lot of questions. Some of them are related to health, and some of them are related to just business operations. But one of the questions that I think maybe you could help shed some light on is if a business, if someone who works at a place of work is diagnosed with COVID-19, if you have a coworker or yourself who's diagnosed with the disease, what happens next? Obviously, I think employees are naturally and understandably afraid, fearful of what that might mean for them. Businesses wonder if that means they get immediately shut down, even if they're an essential business, which we'll talk about in a minute. What happens at a workplace if someone's diagnosed?
Well, I've got good news for you. That's where we step in. I've got incredibly highly trained staff. They're able to advise you. They do an interview of the patient. They find out who's really at risk, and then they make the recommendations and the orders of quarantine. They do the isolation. They'll give you advice on what to do with your facilities. This is a very confusing time. It's driven by rumors. It's driven by people wanting to do the right thing, but we can help direct you. And if your business lies outside of Greene County, you can work with your local county health department. We're all working together, and we understand how to handle this. This is really business that we do every day of the year. Usually you don't know that it happens. That's a good thing, and a good day in public health is when nothing happens. So it's unusual for us to have this kind of attention.
Right. It's helpful just for people to know that there's a process, and that process is not even unique to COVID-19. Communicable diseases in general, you operate
correct.
This way.
Yes, we operate this way with tuberculosis, measles, mumps, you name it.
Great. Thank you so much for that clarification, Clay. Another question, we get a lot of questions related to this idea of essential business. Obviously, Springfield and Greene County and Christian County and Webster and a whole lot of areas around here, and municipalities too, have issued stay-at-home orders. Right. And part of a stay-at-home order is a designation of which businesses have to keep operating and which ones are essentially told to go home.
Right.
And so what can you tell us about this? There's just a lot of mystery, I think, around essential business, because essential for what and what's that look like? I know that this is not the part of it that you're dealing with on a day-to-day basis, but it touches you, I'm sure, frequently. Mm-hmm. What can you tell us about essential business and what that means?
Number one, I think that term essential is an unfortunate moniker because it tells people that are currently not allowed to be open that they're not essential. We consider all business essential. They're really trying to focus on those core businesses that have to be open to keep a community at least surviving through this period of time. So I wish that we could not use essential and non-essential, right. But it is what it is. I would like to emphasize that we're really getting good compliance from Springfield businesses. They've stepped up to the plate. They're doing the right thing. And it's important that as our planning director and our city manager, try to determine whether a business fits that essential business model, they need to understand what the components of that business are. If it's manufacturing, is that part of food processing or medical equipment? If we can get a good understanding of what the product mix is, of the work that is done, they can put that into the online portal at springfieldmo.gov/stay-at-home, or I'm sorry, stay home.
Stay home.
Stay home.
Okay.
And staff can work through exactly whether they meet that criteria or not. We do recognize this is very disruptive, and we don't want to diminish the importance of businesses that end up falling into that non-essential category. But right now, it seems like what we're getting hit with the most, and Mary Lily Smith and Jason Gage and staff are doing a tremendous job, a really heavy lift on this. But we're getting asked from employees of essential business why they're essential. They worry that they're being put at risk. So we've given some guidelines on the Springfield Greene County Health Department's website, health.springfieldmo.gov/coronavirus, some guidance for businesses to find ways to practice their business that maybe will help their employees feel a little better about showing up to work and feel like those risks are lower. And then some of the remaining issues that we're addressing are a little out of the norm. There were state laws restrict the city, like gun sales. That's something that has added some issues. Requirements for car dealers to be open for a certain period each week so that people can renew their licenses.
Right.
This is a very fluid situation, and it's something that nobody ever really anticipated we'd be dealing with.
To me, the thing that, and we've had multiple conversations about this, but it's helpful to just have a sense of what we're, really kind of take a step back from the enforcement components of an order like this and just try to think about, look, what is it that we're trying to accomplish? Mm-hmm. And what we're trying to accomplish is to reduce the density of people to a certain degree. You feel like we're having some success in that regard?
I do.
And so that's a really positive thing. I think employers that I've seen, even those that are essential businesses and are remaining open and operating, are taking every precaution to do what you're describing. I want to encourage people, if you have questions for your business, about your business eligibility or about your employer or anything else, please use the hotline that City of Springfield has set up. That's 417-799-1570. So would encourage you to use that. Please don't use 911 or other kinds. And we have had some reports of that, which you have to understand when that happens, then law enforcement and first responders have to be sent out. And really, they need to have their attention on other things right now. So please, if you have questions about it, use that hotline, 799-1570. Well, Clay, I just can't thank you enough for the tremendous work and leadership that you've done, for making time to be with us again this morning. As you said, well, we got to stop meeting this way, but I look forward to when we can meet another way.
Exactly.
Okay. Yeah. Thanks so much, Clay, for being with us today.
Yeah. I want to thank our community for staying with us through this, and let's continue to steer the course.
Absolutely. Thanks for your leadership.
Thank you.
Okay. Well, as we've worked to produce this version of Good Morning Springfield online and really be able to bring it to you in a way that is convenient wherever you may be, we have been mindful of the number of people who are in DMP's studio today and trying to keep that to a minimum as well. So part of what we're doing is to bring you updates that you might normally receive, or to narrow the number of updates that happen. So if you're a regular at Good Morning Springfield, you know that we typically have updates from the city and the county and Springfield Public Schools and the Chamber in a live fashion. So we have asked our partners if they could stagger that a little bit, so we don't have all of those updates today. But what we do have for you is we have a video update from two key leaders who have really been working very closely together to make sure that the right decisions are made at the right time. And that's our Springfield Mayor, Ken McClure, and our Greene County Presiding Commissioner, Bob Dixon. And so they're going to join us right now with a video update. Let's go to that right now.
Good morning. I'm Ken McClure, Mayor of the City of Springfield.
And I'm Bob Dixon, Greene County Presiding Commissioner. Thanks for having us.
I want to take a moment to thank the Chamber for its efforts in going virtual with today's Good Morning Springfield program to keep us all connected and communicating with each other. While we've had a long shared history of collaboration, my colleagues and I on City Council and our colleagues at the Greene County Commission and surrounding counties have recently worked more closely than ever on this very difficult matter, and with a lot of thought and consideration to develop stay-at-home directives through April 24 to keep our communities safe from the spread of COVID-19. We've been so thankful and overwhelmed by the support we've received. We know it has not been easy, but we're hoping that in the next few weeks, we will start to see that flattening of the curve that we've all heard so much about. We know these unprecedented measures we've had to take for public safety are especially hard on small businesses. We want to encourage the public to support small businesses however you can, whether it's by ordering takeout from a local restaurant or having your car serviced at local repair shop or other examples. There are available resources for small businesses to learn about. I believe these are listed on the Chamber website. Some businesses may still have questions about essential business determination or how to safely operate in a way that complies with the physical distancing requirements. You can find this out by emailing essentialbusiness@springfieldmo.gov or by calling the hotline at 417-799-1570. Our Springfield Greene County Health Department has been working around the clock to track this disease and inform the public. Director Clay Goddard is receiving accolades across the state for the way he has responded to our community. And of course, let's not forget the fact that we have three incredible healthcare institutions, Mercy, Cox Health, and Jordan Valley, which are very vocal in advocating for what they need to care for our community during this crisis. This gives our region a real leg up, and I'm very grateful to them. We are all having moments of anxiety about this right now, but we will get through this together. As a community, staying at home right now and flattening this curve will pay dividends in our ability to recover from this, and it's just the right thing to do.
I just want to take this opportunity to thank everyone for doing their part right now to slow the spread of COVID-19 in our community. While none of us are without impact, the sacrifices and changes being made by all who are participating in this meeting today and beyond are noticed and very deeply appreciated. Again, thank you for the creative ways you are serving this community, keeping your businesses open where possible and caring for your neighbors. These are not easy times, but I want to assure you that we are doing everything we can to protect life on a mass scale, and that includes the recent stay-at-home order in Greene County. The county worked closely with our friends and partners at the City of Springfield to create the language in that order. We looked first to the Homeland Security guidelines and at what other metro areas had done as a starting point. We were careful to create a broad list of exemptions to allow business owners to work with their legal counsel to determine the best course of action for their individual situations. That said, the order is designed to encourage people to take the safest route to minimize both their medical and legal risks. While I can't say when things will return to normal, what I can tell you is we will continue to collaborate and we will work together like never before to do what is best for the immediate as well as the long-term future of our community. So please continue to physically distance and wash your hands and help slow the spread of this virus. For now, we must all stay the course, but we will get through this together. Thank you.
Another vital partner throughout this effort has been the Springfield Area Chamber of Commerce. And I want to thank them for being such an encourager to our businesses and helping them get through this very, very difficult time.
They are a tremendous convener and conduit of information when it comes to things like the recently passed CARES Act and how we recover together. Rest assured, just as we've gotten through this together, we'll get through this together, we will recover together.
Our special thanks to Mayor Ken McClure and Presiding Commissioner Bob Dixon, not only for bringing that update to us today from a video recorded yesterday, but also just for their tremendous leadership in our community. One of the things I thought about, even as we had Clay Goddard on a moment ago, and certainly as we think about these two leaders, is the real benefit that shows itself in times like these in a community like ours that is collaborative by nature. So as we don't have to build those relationships in the midst of a crisis, they exist, and that's a great example of it right there. And they're focused, of course, on the economic activity of the region and balancing that with the health needs, and at the same time crafting public policy around that. And speaking of crafting public policy around the balance of health needs and economic needs, not only of our communities and our state, but our nation, we are very, very pleased to have with us today U.S. Senator Roy Blunt, who has been leading on this and in so many other ways for our state for quite some time. In fact, even before the current crisis, maybe the biggest news in our community for a number of months was the delivery of a federal build grant of $21 million for a big infrastructure project on Grant Street in Springfield. And Senator Roy Blunt, you were instrumental in helping us get that done. So thankful for your leadership in so many ways. And thank you so much for joining us today.
Matt, great to be with you. I missed Clay. I look forward to hearing more as I get a out of what's happened already and what the Greene County Health Department is doing. And of course, I know Robin is there with you as not only the president of the chamber this year, but also somebody who can really explain from the lender's perspective what's going to happen with these small business loans. But great to be with you, and good to be with 500 Southwest Missourians or so as you have your Springfield Chamber friends on the call this morning. Let me just kind of give 3 or 4 highlights, and then maybe we can talk about anything you want to talk about. You know, the bill that we passed is the third bill that we passed a week ago is the third bill that we passed responding to this virus. You know, none of the economic news, by the way, is good. None of the numbers are good. This morning, just announced an increase of new people on unemployment by 6.5 million. Last week. That's added to 3 million new people the week before. So just in 2 weeks, 9.5 million people have gone on unemployment that were employed 2 weeks ago. Obviously, when you hear the potential numbers, the death numbers for the country, where you begin to talk about 100,000 as a success, and somewhere in the range of 100 to 200,000, way below what could happen on the outside of this if we don't continue to do the right thing. So there's a lot of things to respond to here. One is the health crisis, and another is the economic crisis. On the health crisis front, we put a lot of money in this bill. It's the part of the bill that I principally was responsible for trying to put together, which was the healthcare part. You know, I chair the funding committee for Health and Human Services, which includes the Center for Disease Control and the National Institute of Health, and Dr. Fauci at the infectious disease area there, as well as BARDA, the group that looks at being sure we have the stockpiles we need ready for some epidemic like this. Though this is an epidemic where we think nobody's ever had this, no humans ever had this disease before right now, and so trying to figure out how to respond to it's a big challenge. I would say I talked to Secretary Azar late last night on our desire, basically coming out of a call I had with the Missouri Hospital Association, to get money out quickly to hospitals. We put $100 billion in this bill, principally for hospitals. Somewhere between 35 and 50 billion of that will go out in the next 2 to 3 weeks to basically every Medicare and Medicaid hospital provider, and some providers beyond hospitals, but most of this money is going to go to hospitals and really designed initially to fill the gaps of the kinds of elective procedures that hospitals would have had in February and March and now into April that they have put off. And so their income stream is dramatically down in many cases. About, again, 35 to 50 billion dollars will go out quickly to those hospitals. Another maybe $20 billion will go quickly in addition to that money to rural hospitals, to areas where the disease is already surging, and to uninsured hospitals. Hospitals like Truman in Kansas City, where almost all of their clients come in without insurance, and many of them without a government program, as well as not having insurance. So the healthcare piece is a big part of this. I think American families generally are waiting to see when they get that assistance check that they'll be receiving. And that check should also go out in the next 2 to 3 weeks and basically go out through the IRS. And that's the quickest way we decided to distribute money based on the banking account information that most people put on their tax form of where they'd like any refund that they have to get deposited. So that money will go directly, in most cases, to those accounts that people who paid taxes have already submitted. If you're on Social Security and didn't pay taxes, the Treasury Department and IRS announced yesterday that they think they can also get your check to you without you having to fill out anything new. So the whole goal here for individuals who make less than $75,000 or couples who make less than $150,000 is to get them $1,200 for each adult at the home and up to $500 for children that are still dependent on their parents. So a traditional family of 4 would get $1,200 twice for each of the 2 adults, and another $500 twice for each of those kids at home. So a family of 4 will get $3,400. Most families in Missouri are going to get that money. Most individuals in Missouri are going to get that $1,200, and most of them should have it by the 15th, maybe the 21st of April, and that'll go into your bank account. And part of that is to create some money in the system that wouldn't be there otherwise. I'm not sure that stimulus money ever works exactly like advocates for it think it will work, but I am sure this is a case where people have child care expenses they might not have had otherwise with kids out of school. They have health care expenses they might not have had otherwise. And frankly, they just have bills to pay, and particularly those people who have lost work or out of work. And then the second part of the bill, probably to our audience this morning, equally important, is the small business paycheck protection plan that put together. Robin will know more about how to explain that from the point of view of the lender than any of us would. So far, initially, SBA qualified lenders would be the lender, but Treasury is trying to figure out how to involve as many banks as possible into that effort to encourage people to keep people on their payroll and off the unemployment rolls. Now, why would you want to do that? One is just the paperwork of moving everybody from employment to unemployment and back. But 2 is the whole idea that the Congress had of trying to make it obvious to you that you're still part of that team, obvious to you that there's going to be a job to come back to, and that your employer, with the help of the federal government, if you're an employer that has less than 500 employees, your employer, with the help of the federal government, doing everything they can to keep you on their payroll. Now, frankly, unemployment, with a part of the bill that I didn't agree with, is in many cases now providing more money than if you stayed on the payroll. This is something that the Speaker insisted on, the White House finally agreed to, and so for at least 4 weeks, people going on unemployment could get the regular Missouri unemployment plus $600 a week more than they would have gotten in regular unemployment. For many people, that's going to be more than they might have made at work, and that's going to distort our effort a little bit to try to keep people on the payroll. But that program is there. It's going to be, I think, widely taken advantage of. Reaching out to your banker, who should have some regulations by Friday, probably published by Monday. I think bankers are going to have them earlier than Monday, but everybody could go to the SBA website and see what those regulations are by the first of next week. And then another plan, less money, but another plan to kind of look at the critical industries in the country, like aviation in our state with Boeing and all the subsidiaries of Boeing, or travel, which has been dramatically impacted by that. So hotel owners, restaurant owners, others that have some access to some special consideration in the bill. If you're a hotel owner and you have 5 hotels and each of them have 400 employees, you can apply with each of those units separately, so you're still considered to be an employer of less than 500 employees at each of those units. But that's generally available to hotel owners and restaurateurs who have multiple locations, but have multiple problems because they've got locations that people just simply aren't using. So a lot of things going on here. I'd be glad to talk about any of them that you'd like to talk about, and I'm glad you're well resourced there today with Robin and others to talk about the specifics of what's going to happen here. And I'm glad to be with you this morning, Matt.
Well, Senator, thank you so much for being willing to join us today from Washington and being able to share the latest here. And I want to thank you for your work as well on this really important topic. You touched on a couple of things that I don't want our audience to miss. One is the healthcare support that's there. I think probably it's possible that some people think, well, if there's one industry that's doing plenty of business right now, it's healthcare. And while that's true, you touched on the key issue there. They've created capacity for this crisis by pushing out all of the business that used to fund capacity for crisis. And so having that help is critically important. We're obviously getting a lot of questions from our members and from others in the community about how to access those paycheck protection funds for small businesses. The employee retention tax credit also really a help to small businesses. So all of that's really, really, really valuable and an unprecedented move at the federal level. And I'm so grateful for your leadership. I guess what I'd like to do in just our few minutes remaining, Senator, is kind of tap your perspective. I know that you are a history buff. I know that you know history well. And I know as you look ahead, you're probably thinking about what this looks like for us going forward. It's an impossible question to try to predict how long we're going to be where we are, but it feels to me and to many of our members like I think the extent to which we're able to come out of this economically with some strength is going to depend a lot on how long we're under the current conditions. I just wonder, as you hear from and talk to people in the administration, other leaders in our nation's capital and other U.S. senators, what kind of perspective are you getting? What's your expectation moving forward as a country right now?
Well, this is one of those times when it's truly accurate to say nobody knows. We've never had this kind of situation occur before. And I've been in the Congress a while. This is the third of the things like this that had a similar feel. One was 9/11. One was the economic crisis in 2008 and 9. And now we have this unprecedented crisis. It's a little bit like both of the others. There's a little bit of a 9/11 sense here of people wondering what's going to happen next, wondering how it's going to impact them, wondering how safe they are no matter how many precautions they have taken. But, if you remember, Matt, after 9/11, the American people basically said, we're not going to let the terrorists win. And if anything, might have gotten even more aggressive in their social interactions, their willingness to go to events, things like that. 2008, the economy slowed down, but not like this. Not like this. I think when people analyze today the unemployment numbers of the last 2 weeks based on what happened bottom of 2008 and 9, we're going to find out we're already there, but we're already there following maybe the strongest economy we've had post-World War II in February. Just 2 months ago, we had this unbelievable set of economic statistics to look at. And we really don't know. I think it does matter a lot how quickly we come out of this. People are beginning to talk about maybe Memorial Day as one of the points to look to, because I think warm weather is going to have a positive impact here. It doesn't mean this won't come back in September or October, but if it does come back, one, a number of people will likely have some level of immunity to it who have already had it. And two, we'll be in a better position on therapeutics and a long way toward hopefully having a vaccine that could be available sometime early next year. You know, if from February 1, we got a vaccine available to people in 18 months, that would be a U.S. record. I think we're trying to set that record and make it even better. But we need a little extra space here, and hopefully we'll get that in the summer. The modeling on the virus, by the way, for Missouri is that we'd likely hit our peak about mid-May, a little more than a month from now. And this will clearly not peak at the same time all over the country. It's a big country, it's a diverse country, it's a country that socially interacts in different ways. And Los Angeles, New York, two places that have people coming in from all over the world all the time, logically become areas that have big problems early, and then they, of course, have those huge populations. The one good news I saw in our projection for our state is that it looks like, at least the model would look like, that we will have all the hospital rooms we need, which would be an indication that if that turns out to be the case, maybe the impact will not be as great where we live as it is in some of the other places in the country. And let me make one more point on your hospital point. You know, the hospital, one, had given up a lot of income with elective surgery. And one of the unfortunate reasons they've had to give up that elective surgery is not just repositioning and getting ready for this, but not having enough of the personal protective equipment that you may need for coronavirus, so you can't use up a lot of it in other surgeries and other elective treatments. And that's one of the reasons the federal government is trying to step in and help with that cash flow. Hospitals are very much an income in and income out kind of business. And when you don't have the income in, you still have the income out if you want to have your staff and your hospital ready for what we're going to need them to be ready for in our state, and increasingly between now and maybe mid-May. And in other places, different levels of this have already impacted.
Well, Senator Blunt, I'm so grateful for your leadership and for your generosity with your time today. I know you have other commitments this morning as well, and so we want to let you go to those. But before I do that, I just want to thank you for your leadership. I want to thank you also for your team. We have found Joelle Cannon here in Springfield to be just a tremendous daily resource on this, and really just our entire congressional delegation in this area has been fantastic. But thank you so much for joining us today, Senator.
Your congressional delegation in Washington works together as well as any state in the country. We get together at least once a month. It's a great delegation. Obviously, Congressman Long and I have a great working relationship. Our families are close, and that's the case really throughout our delegation. So we're lucky to get to work for you, and hopefully we're working for you the way you want us to right now in this moment of unique challenge.
Thanks so much, Senator, for being with us today. So just a really helpful insight, I think, and perspective from really, in another way, the front lines in Washington from a public policy standpoint from Senator Blunt. And I mentioned really our entire congressional delegation, Senator Long's team here in Springfield, Senator Hawley's team in Springfield, of course, Senator Blunt's team as well. We've just been really grateful for the constant, regular support and update that we've received from them along the way. Well, Senator Blunt mentioned, and we have with us today, joining us, our chairman of the board for the Springfield Area Chamber of Commerce this year is Robin Robeson, and she is the Chief Operating Officer of Guarantee Bank. And I've said to you, Robin, multiple times how thankful I am that we have you in this role right now. For a number of reasons, but particularly for a crisis that none of us could have anticipated, to be able to bring to bear some real expertise and resources to this. So thanks for joining us today, Robin.
It's nice to be needed, Matt.
Well, you're definitely definitely needed. So I wonder if we could just get right to it. Senator Blunt mentioned the CARES Act, which is phase 3 of this federal relief package. It provides $2 trillion in emergency assistance to organizations and individuals impacted by COVID-19. by the pandemic. Loan options that are available through this program could be of particular help to small businesses, helping with items like payroll and rent, utility costs that small businesses can't get that income that they would normally get to cover those costs. Thought that we would just call on your expertise with a career in banking, and also particularly with a bank right now that works with the Small Business Administration a lot. Could you talk to us a little bit about this Paycheck Protection Program? It's a $350 billion small business loan program that it's 100% federally guaranteed. A lot of it can be forgiven, so a lot of it turns out to be grant. Talk to us a little bit about that program. We're getting a lot of questions about it.
Sure. Well, Matt, the Paycheck Protection Program, and it's a mouthful to say, so we've just started calling it the PPP, is really for any small business with less than 500 employees. And this includes sole proprietorships, independent contractors, and self-employed persons, as well as 501c3 nonprofits and veterans organizations that are affected by COVID-19. And businesses in certain industries may actually have more than 500 employees if they meet some SBA size standards for those industries. But in general, it's for businesses with 500 or fewer employees. So the PPP is administered through the Small Business Administration, and the way that you apply is through a local financial institution. And I'm proud to say that the organization I represent, Guarantee Bank, is a preferred lender with the SBA, and there are many other local banks that are also preferred lenders and are very, very familiar with SBA programs. And soon, as Senator Blunt said, all banks that choose to participate should be able to facilitate PPP loans. And my advice to our listeners, to our members, would be to contact your banker and have a conversation about your specific situation, and they can guide you through all the programs that are available to you. This is a time where expertise and experience matters. So I encourage businesses to use their professional advisors like their banker, their CPA, their attorney. These advisors will be very valuable and helpful to you in this time of uncertainty. So starting tomorrow, April the 3rd, small businesses and sole proprietorships can submit an application for a PPP loan. And starting next Friday, April the 10th, independent contractors and self-employed individuals can apply through an SBA lender. So please contact your banker soon, if you haven't already done so, to get the ball rolling. We know that the demand and the requests volume is going to be higher than we've ever seen. And so please be patient and know that your banker wants to assist you, and they will get back with you just as soon as possible. But don't hesitate to go ahead and make that call.
You know, a lot of the very urgent calls that we're getting from and proactively going out and reaching out to members to try to find out what those needs are really center around about three areas for this relief package that came through. One is what we're talking about a lot today, which is the availability of capital through mostly lending programs and some that are forgivable loans. Then there's also tax implications. So there are tax credits that are built into this that are very unusual and that people probably aren't very familiar with. And then there's the aspect or component of it that has to do with unemployment insurance and how that is claimed and what's available for employees and the impact on employers. The tricky thing, and you mentioned it, Robin, is while those are three big categories, any move you make in one of them potentially affects the move you can make in one of the others. So how important is it right now to be talking to your banker, talking to your accountant, really running the analysis on this?
I think it's of paramount importance. Now is not a time to go this on your own and try to figure it out. There's a lot of information, some of it even conflicting information that you might find out there. So, utilize your resources with your professional advisor, and that will really help to make it a more seamless process for you and hopefully get you the aid and the relief that you need much quicker.
So tomorrow's a big day and next Friday's a big day.
And next Friday's a big day,
okay.
Yes.
Now, in this category of available capital and lending and liquidity for businesses, there's the PPP, so the Paycheck Protection Loan. If I heard you right, the big advantages to that is a portion of it can be forgivable, that you can use your own bank, and that it's supposed to move pretty fast. But that's not the only loan or liquidity program available for the needs and the impact of this. There's also the SBA Economic Injury Disaster Loan Program, and Missouri is one of the states that's approved to take advantage of that program. Loans of up to $2 million can be used to pay financial obligations, operating expenses. And one of the unique dynamics of this is, while it might take a little longer to get that loan, you get an advance, that itself, the advance may be forgivable. The loan's not forgivable, but the advance may be forgivable. Talk a little bit about these these EIDL loans.
EIDL, that's what we're calling them,
EIDL.
because again, it's a mouthful, the name. So we're referring to them as EIDL loans. They're another great opportunity for small businesses to get relief. But there is a big difference in how you apply for the EIDL loans and the PPP loans that we discussed previously. EIDL loans are actually obtained directly from the SBA and not from a local financial institution. You would apply directly through the SBA for one of these loans. But I would also encourage you and say that utilizing your professional advisor like your banker for information and advice on SBA loans, especially SBA preferred lenders who really have expertise and experience in doing SBA loans, can be a great resource, because they are familiar with all the programs and they know how to guide you, in which loans are right for your situation, and the timing and the order in which to apply for them. We know that, you want to spend your limited time, doing things that are going to reap results. And so none of us have time to waste. And so I think that utilizing your banker, your CPA, your attorney to help with that is going to go a long way. No one just has time to be spinning their wheels right now. Businesses should be sure to keep very accurate and careful records and documents and losses about the losses to their business to increase their chance, of being approved. So keeping your records is really good. That's another reason why your CPA is so important in this. How you would actually apply for the loan is online at sba.gov/disaster. That's sba.gov/disaster. And there's also a link to that from the Chamber's website. Now, the SBA website has been heavily trafficked. It is overloaded, and it's actually crashed a couple of times, but they are working hard to expand their capacity and be able to meet that demand. So you might have better luck if you go out there and apply during some non-peak hours, maybe between 7 p.m. and 7 a.m. instead of the opposite.
Go get your SBA loan at 2 o'clock in the morning after you watch your latest Netflix.
And be prepared when you go to the site. When you get on the site, have all your information. That will be very helpful as well. We also believe that there's an opportunity to obtain both PPP loan and an EIDL loan, as long as they're not for the same purpose. Okay. So again, this is where an expert, can be really, really helpful to you in this case.
Well, there's gold all through that. Really valuable advice and instruction for people. Robin, I know that you and everyone in your profession and in other professions that we're leaning on heavily right now are working so hard to be up to the moment, learn everything you can about a lot of new things. So valuable for us that you're able to share some of that. And I know also that as the chairman of the Chamber Board this year, that the success of the Chamber and the ability of the Chamber to serve businesses well is critically important to you. Also, it's the passion that brought you to this position. Yes. We get to talk every day and sometimes multiple times a day right now about what's going on and how best to serve our members. Could you just talk a little bit about that, about your perspective on that?
Sure. Well, I would just encourage our members to lean on the Chamber for information. The Chamber's website is a great place to start. We're tracking local and state and federal policy information, and we'll post that information on the Chamber website, and it can be really, really helpful to you. And that's at springfieldchamber.com/coronavirus. I'll also tell you that the Chamber is posting the latest information and member news on their social media accounts. So this is a great way to stay up to speed on what the other members are doing. In addition, we have a special coronavirus email address for your related questions. So staff will work to put you in touch with the right resources and share your concerns with decision makers as they focus on responding to the economic impact of this disaster. So if you have questions, thoughts, concerns, please email the Chamber at COVID-19@springfieldchamber.com. That's COVID-19@springfieldchamber.com. And, Matt, this is hard for every one of us. There's uncertainty, there's hardship, and economic stress, most certainly. When I started this year as chairman, I certainly didn't envision that this would be how the Chamber would be focusing its time. We had some big, bold ideas in our 2020 strategic plan and our action plan, and those are understandably on hold right now. but it's important today that we are meeting our members right where they are and are working to help you attempt to stabilize your business and prepare for a recovery. So I hope all of our members know that we are working hard on your behalf, and we'll continue to do so until our community and our country have come through this unprecedented time. And then just lastly, I think I would be remiss if I didn't say how important I think it is for the business community to support our city and county officials in abiding by the stay-at-home order and doing everything that we can to flatten the curve. It's painful, I know, but the sooner we can get through this, the sooner we can get back to those big, bold plans that we had for 2020. So I'm still honored to be in this role. Never thought I would be doing Good Morning Springfield this way, but it does provide at least some sense of normalcy, honestly.
Right. Kind of feels good, doesn't
it does.
Robin, I'm just so thankful for you and to you for your leadership in this time. Things happen for a reason.
Yes.
People are in places that they are for a reason, and I believe that you're in the position you're in for just this kind of leadership right now. So thank you very much, Robin. And thanks also for those who are looking for additional resources. Just as Robin mentioned, please go to our website, springfieldchamber.com/coronavirus. You can get more information there. One of the things that we are doing and that a lot of people are doing right now, a lot of media organizations, a lot of trade associations, chambers of commerce, trying really hard to provide you with a broad overview of what all this means. New tools that are at your disposal that you didn't have before, that none of us fully understand just yet. So we're trying to be fast. One of the things that I want to make sure that we're committing to you from just as a resource of the Chamber of Commerce is that we will try to be fast, even if we're not first, but we will always be precise. And so what we have for you on that site and in other cases and with resources like Robin that we bring to the table, you can take it to the bank. Okay, thanks so much, Robin. So with that, I want to take just a moment if I can. And as mentioned earlier, our monthly sponsor for Good Morning Springfield this month just so happens to be Cox Health. And Cox Health is not only a tremendous supporter of our community and of the Chamber of Commerce on a variety of different ways, but right now, of course, is intensely focused on the response to COVID-19. Their efforts to be prepared for those needing treatment, also to protect their employees on the front line and to flatten that health curve that you've heard us talking about, really is nothing short of phenomenal. And we are so fortunate to have such tremendous health systems in our community to be able to do this. Collaborative leadership of Cox Health CEO Steve Edwards has just been incredibly beneficial to our community in this fight. He is right where he needs to be today, which is at Cox Health, serving on site at the hospital. But he, as our April Good Morning Springfield sponsor, did send us this update by video to share with you. Let's go to Steve now.
Good morning, Springfield. I'm Steve Edwards. For those of you I've not had a chance to meet, I serve as president and CEO of Cox Health. We're making a special message because we have a virtual meeting this Thursday. This is recorded on March 31st. We know that things get out of date quickly, so you have that reference point. I want to begin by talking about some of the 4 things we're focused on: suppression, stuff, staff, and space. Probably the most important thing we can do as a community is to focus on suppressing or causing that curve to bend down instead of exponentially up. Our community leadership, our Mayor Ken McClure, our city council members, our presiding commissioner Bob Dixon, and the commissioners and other counties have stepped forward and made a very important decision. This changes our numbers, and we're beginning to see what we think might be early indications. This is helping nationwide, and we think Springfield as well. We're also seeing similar measures in Jeff City, Columbia, Kansas City, St. Louis. I advocate for doing it in the whole state because we have a referral base that's broader than just Greene and Christian County, and I think Webster County now as well. But we're grateful for our leaders who have done this. We know it's a tough decision. We believe that when you flatten this curve, then you'll get back to business earlier too. So if we can suppress this, it helps our economy. We're going to have struggles either way. Stuff, those are things like PPEs. Those are personal protective equipment. We're zealously going after that. We're looking at our normal supply chain. We're going outside of our normal supply chain. And even more importantly, we're looking at local manufacturers who are helping us. So I want to acknowledge the work of Jordan Valley Innovation Center, who's working with face masks, who's working with re-sterilization methods and other technology we can do to create more PPE. I want to acknowledge Justice in Lebanon, Missouri. They are making face masks and gowns for us as well. Very grateful for them. Ventilators, another big challenge, of course, we're keeping our eye on. We have about 131 ventilators on service right now, or available to be on service, with hospital-based anesthesia machines. That could add almost to be about 200. Our patients in the hospital are generally been moved to what is a medical ICU. We're calling it a respiratory ICU. Now it's on our 5th floor. There's a step-down unit next to it for patients that don't require ICU. And then we're building out on the 5th floor of the new tower, a 51-bed ward-style ICU unit. J.E. Dunn's leading the charge. They're going to get it done in 2 weeks, but it could be very important to meet a spike in demand. Staff is of critical importance. That's why PPE is critically important, because we can't protect our staff without PPEs. Space, we're making many changes that you've seen, we've talked about in the past, like ER, et cetera. Testing is very important. Our labs are getting up to speed now. We just don't have enough testing capability due to the viral testing media and things like that. That's being produced. We hope that will improve as well. I'm grateful for J.E. Dunn, Great Southern, Discovery Center, Springfield Public Schools, every restaurant in town that's feeding our staff virtually every day with free food and supplies. We really greatly appreciate it. If there's one last thing I can ask us to do as a community, staying home will save lives. We need you when our nurses and our doctors and our staff are putting themselves in harm's way. We can only beat this if we work together, and that means you have to stay home for us. We appreciate how united our community is. We appreciate our partnership with Mercy and Jordan Valley and others that are working together to help our community.
Well, we are so grateful for Cox Health and for your sponsorship of Good Morning Springfield in April, and just for your leadership in our community and just for the health systems that we have in Springfield. Yes, it worked out very, very well that Cox Health was our sponsor for this month, but big thank you to all of the health systems, to Mercy, to Jordan Valley Community Health Center, and of course to Borough Behavioral Health. That's helping in a variety of different ways right now. Our community and the collaborative nature of these competitors, but who are willing to work together, is really, really critical right now, and we're so benefited as a community by it. Also joined now by another great, tremendous asset to our community, and that's Rick Britton, who is owner and president of DMP. That's where we are right now, and so this is an essential business, so you're working every single day to do what you do and produce the products that are necessary to help keep us safe in a variety of different ways, and also just lending us this, this set, your team, Mark Hillenberg, and the whole team here have just been tremendous to work with. I can't thank you enough. I just want to take a moment to thank you, Rick, and to ask you to tell us a little bit about the work that you're doing here and how you're working through all this.
Well, thank you, Matt. Thank you for all your work you're doing. This has been a really good program. I especially appreciate the things like that you've told us individually, and then on this program, as you've talked about, if somebody is tested positive, how the Greene County Health Department is going to come help you, because that's a lot of questions. That what happens if
Sure.
it happens here. So as an essential business that is building, supporting security equipment for a lot of essential functions throughout the United States, we have people on the phones preparing equipment for the government, for banks, for a lot of key industries throughout. And so we're so pleased with our people that want to come. We have about 90 people that are working remotely here and scattered across the country. And then here in the office, we have instituted so many changes for social distancing. And you go into conference rooms and every other chair is gone. And people are moving further and further apart as they're standing. And so the cleaning crew, they are working nonstop in taking care of everything. But another interesting thing that's happened is just like this meeting here on the video conference, we have had to change ways that we train and talk and communicate with our dealers. And we found some things that are really effective.
Oh, really?
So we will probably be doing quite a few things that we learned during this period, continuing on. Wow. That we can actually reach some of our own folks and our customers and work with them. We'll be more effective and more resilient just from some of the things that we've learned through these few weeks.
That's amazing. What they say, the necessity is the mother of invention.
It is.
And,
it is.
I've been amazed at how businesses respond. I mean, if you think about it, it's not surprising. You're entrepreneurs by nature, and so innovating just kind of goes with the territory. But yeah, you're discovering things as you go here.
It really works great.
Well, Rick, thank you so much for joining us today and just for being such an incredible host. We're so grateful to be with you today.
Thank you for being here.
Thanks so much, Rick. Well, we really appreciate you tuning in this morning for Good Morning Springfield. We've never done this before. We've never tried to do a virtual Good Morning Springfield, but we're really glad that you stayed with us today and joined us for this. I want to thank our sponsors again, BKD Wealth Advisors and Cox Health, and also our host and producer of this live stream program, DMP. So grateful for them and for their partnership as well. The Chamber of Commerce team, the Springfield Area Chamber of Commerce team, is here to help serve as that trusted resource for reliable information for you and for your business. And I want to make sure that you know how to take advantage of that. Our staff team is working hard around the clock to keep the special coronavirus webpage on our site up to date. That is updated daily with timely information and links to resources. And it's organized and sorted in a way that you should be able to navigate it. So please do visit springfieldchamber.com/coronavirus if you'd like to learn more about the latest and those things that are available, particularly resources for your business. And you can always email us your questions at COVID-19info@springfieldchamber.com. That's COVID-19info@springfieldchamber.com. We're also here to capture your questions and document the challenges that you're facing, the pain points that you might be having right now as a business, so that we can communicate those to policymakers who are making decisions about the future and how we support recovery going forward for our economy and for our businesses. So please don't hesitate to contact us with any obstacles that you're encountering, big or small. We'd like to know about it so that we can do our very, very best to help support you in every single way that we possibly can. So many of you are out there providing solutions and innovating, just like Rick Britton just shared with us, innovating to help our community successfully respond to these challenges and innovating to find new ways of doing business. You are also offering much needed expertise to other businesses to help them survive and position themselves for recovery. So please share what you're doing. We are providing lots of platforms where businesses can share with each other some of the things that they have going on. So grateful for your membership and for your commitment and support of the Springfield Area Chamber of Commerce. Thanks for being a part of the Springfield Area Chamber of Commerce, and I want to ask you to stay in touch. We'll see you next month, either in person or virtually, for Good Morning Springfield on May 14th. Good Morning Springfield.